Hi, hello guys. Welcome to Medicine Simplified. Today we will understand about leukemia, its etiology, pathophysiology, classification and clinical features. So what is leukemia? It is a group of malignant disorders affecting the blood and blood forming tissues of bone marrow, lymph system, spleen. It occurs in all age groups. Results in an accumulation of dysfunctional cells because of loss of regulation in cell division. It may be due to dysfunction of apoptosis or DNA repairing gene. It can be fatal if untreated. Often thought of as childhood disease, but number of adults affected with leukemia is 10 times that of children. Coming to the etiology and pathophysiology, there is no single causative agent. Most from combination of factors like genetic and environmental influences. Agents associated with development of leukemia are chemical agents, chemotherapeutic agents, viruses like HLVT1 and 2, radiation, immunological deficiencies. We all know that blood cells are developed from hematopoietic stem cells, which can be classified into myeloid stem cells and lymphoid stem cells. Leukemia can be caused due to mutation in hematopoietic stem cells or myeloid stem cells or lymphoid stem cells. Coming to the classification of leukemia, there are two major types and four subtypes. First major type is acute leukemia, which is further classified into acute lymphoblastic leukemia. Second one is acute myelogenous leukemia. Second major type is chronic leukemias, which is further classified into chronic lymphocytic leukemia, chronic myeloid leukemia. Coming to the myelogenous leukemia. Leukemia characterized by proliferation of myeloid tissues like bone marrow and spleen, and an abnormal increase in number of granulocytes, myelocytes and myeloblasts in circulating blood. Myeloid tissue is biological tissue with ability to perform hematopoiesis. It is mainly found as red bone marrow in bones and is often synonymous with this. However, myeloid can also be present in liver and spleen. A myelocyte is young cell of granulocytic series, occurring normally in bone marrow but not in circulating blood. Granulocytes are category of WBC, characterized by presence of granules in their cytoplasm. They are also called as polymorphonuclear leukocytes because of varying shapes of nucleus, which is usually lobed into 3 segments. The myeloblast is unipotent stem cell which will differentiate into one of the actors of granular series. Acute myelogenous leukemia. Leukemia characterized by proliferation of myeloid tissue and an abnormal increase in number of granulocytes and even myelocytes and myeloblasts in circulating blood. It is seen in 1/4 of all leukemias, that is 85% of acute leukemias in adults. It is abrupt and traumatic in onset. It causes serious infections and abnormal bleeding. Uncontrolled proliferation of myeloblasts can cause hyperplasia of bone marrow and spleen. Acute lymphocytic leukemia. Most common type of leukemia in children. 15% of acute leukemia is acute lymphocytic leukemia seen in adults. Immature lymphocyte proliferates in bone marrow. Signs and symptoms may appear abruptly like fever, bleeding, insidious with progressive, causing weakness and fatigue, and there can be a central nervous system manifestations. Chronic myelogenous leukemia. Excessive development of mature neoplastic granulocytes in bone marrow, which moves into peripheral blood in massive numbers. So there will be increased WBC in blood. Ultimately infiltrate the liver and spleen. Philadelphia chromosome. The chromosome abnormality that causes chronic myeloid leukemia. It can be used as genetic marker. Chronic stable phase followed by acute aggressive phase. Chronic lymphocytic leukemia. Production and accumulation of functionally inactive but long-lived mature appearing lymphocytes. B cells are involved. Lymph node enlargement is noticeable throughout the body, which are signs of increased incidence of infection. Complications from early stage chronic lymphocytic leukemia is rare, but may develop as disease advances. Pain, paralysis from enlarged lymph nodes causing pressure. Hairy cell leukemia. 2% of all adult leukemias causes hairy cell leukemia. Usually predominant in males above the age of 40 years. It is a chronic disease of lymphoproliferation. Mainly B lymphocytes infiltrate the bone marrow and liver. The cells have hairy appearance. That's why it is called as hairy leukemia. Symptoms are splenomegaly, pancytopenia, other infections, and vasculitis. Treatments include alpha interferon, pentostatin, cladribine, etc. Coming to the clinical manifestations of leukemia. Related to problem caused by, first one is bone marrow failure. Overcrowding by abnormal WBC cells. Inadequate production of normal marrow element. Anemia, thrombocytopenia, decreased number and functions of WBC. Leukemic cells infiltrate patient's organ. They can be splenomegaly, hepatomegaly, lymphadenopathy, bone pain, meningeal irritation, and oral lesions like chloromas. Coming to the diagnostic studies, to diagnose and classify leukemias, we should perform peripheral blood evaluations like CBC and blood smear. And there should be a bone marrow evaluation also. To identify cell subtype and stage, there should be a morphologic, histochemical, immunologic, and cytogenic methods. Coming to the management, the goal of leukemia management is to attain remission when there is no longer evidence of cancer cells in the body. First option is chemotherapeutic treatment. Induction therapy. Attempt to induce or bring remission. Seeks to destroy leukemic cells in the tissues, peripheral blood, and bone marrow. Patient may become critically ill. So patient need psychological support as well. Intensification therapy. High dose of chemotherapy may be given after induction therapy. So it is the first stage of therapy. Same drugs at higher dose and other drugs. Consolidation therapy. Started after remission is achieved. So there will be no cancer causing cells. Purpose is to eliminate remaining leukemic cells that may not be evident. And final stage is maintenance therapy. lower dose of same drugs. Bone marrow and stem cell transplantation. It eradicates the patient's hematopoietic stem cells and it is replaced with those of HLA matched, which can be taken from siblings, other volunteers, identical twins, patient's own stem cells removed before leukemia. Coming to the differential diagnosis, first one is aplastic anemia, second one is myelodysplastic syndromes, third one is multiple myeloma, fourth lymphomas, fifth one severe megaloblastic anemia, sixth leukemioid reactions. If you like this video, please do subscribe to our channel. Thank you.